I'm Chief of the Breast Cancer Medicine Service at Memorial Sloan-Kettering, and I'm also the chair of our newly formed Scientific Advisory Committee for the Breast Cancer Research Foundation. The BCRF, as you know, is really an unusual charity. Myra didn't talk so much about this, and she'll correct me if I'm wrong, but it has a remarkable record of a low overhead and a large amount of pass-through to the investigators, some of whom are on the stage here, and we're going to introduce them in a moment. The reason I'm mentioning that is that all of you are here as our partners, and this event is one that we particularly love for that reason. It is not a lecture. We're not going to stand up here before you and show slides and show data. What we're going to do is engage in a discussion with all of you. And it's a two-way street, this discussion. It's something that we really enjoy. It's one of our favorite events every year because it gives us an opportunity to hear what's on everybody's minds. You teach us the things that you think are your greatest concerns, and it gives us a chance to both allay some concerns and fears, and also it can occasionally inspire us to go off in new directions in terms of research, something that all of us are really dedicated to all the time. So this particular panel today is really devoted to the question of risk, which everybody has to some degree or another, and prevention, which everybody wants to do. And I just want to start off by reminding everybody that 25 years ago, when I graduated from medical school, breast cancer was a fear. There was no sense that you could actually do anything about it. There was no understanding of the genetics to speak of. There was no clear understanding of the role of nutrition or the harm or good that hormones might have done. And I mention all that because there's always a concern about the pace and scale of the progress we make. The panel that you see before you is going to describe to you, I think, what you have to perceive of as remarkable life-saving achievements in many, many ways. And we focus so much of our time on the question of treatment, and that's an important obligation and task of ours, but what we really want to do is not have to treat breast cancer. That's really our first and foremost goal. And so the fact that we're even able to have this conversation is, to me, beyond exciting. It's just a transformation of the disease, and I know the panelists are going to describe very concrete changes in terms of prevention and management of risk that were unthinkable just a few short decades ago.